and do some of the welcome and intro and housekeeping for today. Thank you all for joining us for today's webinar on survey methods and using survey tools to incorporate resident feedback and program design and to evaluate impact. I'm Alexandra Nassau-Brownstone. I'm Vice President of Resident Outcomes and CORES here at Stewards of Affordable Housing for the Future, otherwise known as SAFE. I'm really excited to have a number of people with both expertise and experience in thinking about resident outcomes who are joining us today. My colleague Nicole Manchester serves as Director of Data and Analytics at SAFE, and she's going to be offering some of the bigger picture framing and considerations for thinking about resident outcomes and survey design. Then we're really thrilled to have Katie Carroll of the Community Builders and Letitia Cheney of Decatur Housing Authority. Both are CORES certified organizations who are each going to talk about their own organization's approach to resident outcomes data and surveying residents. Before we jump in, a few minutes on housekeeping and some opening framing. So first, this recording is being recorded. Right, Mina, we're all set?
Yes, we're being recorded.
Great. That's frequently the #1 question we get, and we will make the recording available along with the slides being used today. Also, due to the number of people on today's call, the lines are muted and you are not currently able to share video. But if you have a question, please engage with us. Share the question in the Q&A box. There's also a chat box that many of you are using to say hello. We'd love to see that and engaging with one another. My colleague Mina is going to be keeping an eye on both Q&A and chat. We're going to leave a little time after Nicole's presentation for questions, so make sure to enter those into the Q&A box. And then we're going to shift to the presentations from both Katie and Letitia, and we'll have some more time at the very end for additional questions that come up. So for today's session, we're really hoping that it's going to help you all to think about how the information that you're collecting from residents helps you to shape your priorities for programming and engagement. We often see organizations that have implemented some kind of survey tool, and this can be a survey to better understand what programming residents are most interested in, or to better understand resident satisfaction in the communities where they're living. There are surveys that use self-reported measures on the quality of life, or survey tools and sort of individualized assessments, particularly health assessments for seniors that we see many practitioners are using. Some tools blend sort of a combination of all of these in some different capacity. But often we also see organizations that are implementing tools that aren't really very well aligned with the goals that the organizations have identified for impact, or the tools that the tools sort of feel developed purely for the owners or for a funder. And there's a missed opportunity to also think about engaging residents in how the survey is designed and thinking about what measures might be most useful, both sort of practically and in engaging with residents. So we're hoping to touch on a couple of considerations in today's session and how you're thinking about building a survey and what kinds of measures you're using. Thinking about what types of information can help both to demonstrate impact and feels really practically useful to you in your work. Some considerations about accessibility, how you distribute surveys electronically, in person, paper, format, the frequency. We're going to touch very lightly on privacy concerns. That's a whole other topic into itself, of course. Questions around survey burden. What are we asking of residents? It's a lot of time and energy, and it's voluntary information. So being thoughtful about how and when we're asking for residents to engage with us. And again, that larger series of questions around how are residents included in figuring out what measures are important, how to shape priorities, and how to make meaning out of that information when you do get it back through a survey. So for those of you who've already gone through CORES or have been onto our website, you've probably seen this framework. This resident engagement and feedback is really central to a robust system of service coordination. And this is the framework that CORES was built on. There's a companion set of guidelines available on the website. Mina's going to drop a link to that if you haven't seen it. But throughout this cycle, practitioners are looking at resident data, and this can come from property compliance data and demographics. But a large part of this is coming from the other ways that you're getting direct feedback from residents, often through surveys. And the stars on the framework are showing where we typically see that organizations are either collecting or analyzing resident outcomes data to help shape and drive their initiatives. In addition, there are 2 CORES tools or documents that are required for application for CORES, and both of these often utilize data that's collected through resident surveys: the Resident Opportunities and Priorities Assessment and the Resident Indicators and Analysis Report, which hopefully is really demonstrating impact, perhaps change over time for some of the measures that you're collecting in resident surveys. So we're not going to go into either of these in depth today. We're going to share some links in the chat where you can find some additional information on those. But we wanted to provide that grounding, that framework for why this feels like a sort of salient and an important topic to be engaging with you all. So at this point, I'm going to welcome and pass things over to my colleague, Nicole.
Hi, everyone. This is Nicole Manchester. I'm the Director of Data and Analytics for SAFE. So excited to be talking with you all. So I'm going to talk a little bit about what we're seeing among the SAFE members and some of the core certified organizations. And, you know, everyone is on a kind of spectrum in this work and at different places, but just kind of broadly what we've seen. And so taking a bit of a step back and thinking about the whole cycle of data, I think when you think about data, a lot of people think first about kind of data collection and data reporting, but I think it's important to also think about the other steps of the process, and there may be other steps in this as well, but strategic planning, kind of the big picture planning of what you need and how often, and you know, kind of how it matches to your goals. Obviously, data collection, quality assurance, and data quality efforts to you know, look at the accuracy of the data that you have. Of course, data reporting, and then data storytelling is so critical. And there's been a lot of work in the field about thinking about this. I just stumbled on a quote from an organization called Data You Can Use that says, "No data without stories, no stories without data." And I thought that was a great kind of words to live by if you're a data analyst. You can go ahead and talk about it. So the universe of data that might pertain to resident services, again, you know, this webinar is about surveys for the most part, but just taking a step back, think about the whole universe. Of course, there's data about residents that I'll get into more in a second. There's also program data or staffing data about the types and frequency of programs that are being offered at your properties, perhaps data on staffing hours, and then also community data. You might be looking at data that pertains to the surrounding community or neighborhood where properties are located to identify resources and assets, and maybe try to figure out appropriate benchmarks for the data that you do have on resident communities. The next slide. So lots of different ways that you could be collecting or gathering information about residents, quantitative and qualitative, and you could kind of blend various of these together, and they kind of can be self-reinforcing sometimes. The first one, of course, resident surveys, we're going to talk a lot about, but there could also be interviews with residents, which could be administering the survey in person in kind of a conversational style, or it could be just kind of an open-ended interviews that might be coded in some way. In the data system, service coordinators can be doing assessments of various kinds, like the activities of daily living or social isolation assessment or various things. We tend to see this a little bit more of a quote unquote case management approach to services. You could be doing focus groups or kind of targeted community meetings and gathering qualitative information in that way. Of course, there's gathering resident stories, case studies, lived experiences, some of that good qualitative information. And then also thinking about data from other sources that you could be using to layer with perhaps resident survey data, like data from your property management system, like a Yardi or RealPage, perhaps partner data you might be able to access, or administrative data that's in the community. And then this last there might be other ways of understanding more about residents that aren't listed here. So surveys are not the only way to get information about residents. Keep going. So Alexandra kind of touched on this a little bit, but I think it's important to kind of frame how you would connect data collection to strategic planning in a big picture way across your organization. So, this is really challenging. I don't think anyone has, can say that, check the box and, we've done this and moving on. This is really hard work, but it's important to, think about, for your organization as a whole, kind of your strategic plans and your kind of big picture goals for providing resident services. And this might look slightly different. Perhaps your organization is more focused on like health and wellness. Perhaps it's more focused on economic mobility or community engagement and community revitalization. It might look slightly different. But then when you have those big picture goals, kind of working backwards, thinking about how you can measure your progress towards meeting those goals. And, a logic model might help with that. We see sometimes, and we've heard from the SAFE members that, when you are going along and you have a resident survey, sometimes the survey can over time become what we call here survey creep, which is kind of related to the idea of mission creep, you may have heard, where the survey becomes a little bit of a mismatch of different questions that maybe this funder wanted to know, or this other funder wanted to know, or this one director, a few years ago wanted to know, and the survey kind of gets a little bit messy, perhaps of different kind of questions that keep getting added on and on without anything being taken off, or without kind of stepping back and thinking about, how is the survey as a whole kind of connected with or tied in with our bigger picture kind of strategic goals. But of course, recognizing that when funders want to know information, that is important, and it's hard to kind of find that balance, of course. I think move on now, Brenda. This is an example of a logic model or theory of change that is from one of our member organizations, POA. It's probably a slightly slimmed down version from what they have, but just kind of the basics of the inputs being kind of your safe, healthy, affordable housing, high quality management and services, leading to housing stability for residents and high quality programs and stable property operations, with the ultimate goal of getting to these more long-term outcomes of positive exits, such as purchasing a home or subsidized housing, improved quality of life, improved life outcomes, and aging in place for seniors. Just an example there, I'm sure lots of different ways to put that together. Next slide. So getting into the actual surveys, that's what y'all came here to learn about. Kind of what we've seen across the SAFE members is when you think about kind of the buckets of questions that we see in surveys, we four kind of main buckets. Demographic information and identifiers, like the property that the survey respondent lives in and the unit number. Depends on whether or not you want the survey to be anonymous and kind of how you're administering it. Another bucket of resident interests and needs. So kind of finding out what types of programs or services, supports are most of interest to particular residents, and perhaps other questions around how they might engage with services like time of day and whatnot. The third bucket being around more of the short-term outcomes or outputs, and we include resident satisfaction questions in this bucket. These are sometimes can be the kind of stepping stones to more long-term outcomes, kind of the building blocks of getting to improve long-term outcomes, such as like access to supports or service, like access to health insurance, access to early education enrollment, employment, and then also you might include questions around resident satisfaction and how they're feeling about do they like the program, how do they feel about the staff and the property. And an example that we see a lot is just, would you recommend this property to a friend or family member? And then lastly, there are more long-term outcomes. So questions around kind of your big picture goals around, could be health and wellness or financial stability, educational advancement, economic mobility, all that good stuff. So next slide. So some dimensions to how you might think about your survey, if you're retooling it or expanding it or whatnot. I don't think there's a right or wrong, perfect way to do this. I think it depends on kind of your organizational capacity and what your goals are. So we've seen different organizations take different tacks with this. But some kind of guiding questions being, do you want it to be anonymous or not? So anonymity helps residents maybe answer more honestly, but it does prevent service coordinators from being able to follow up with specific residents to address specific needs. And I apologize if you hear any background noise. There's construction going on outside my window, of course. Second one there, paper electronic. We see quite the range across the SAFE members. Some sticking with paper is just feeling more kind of accessible to residents, particularly properties that have low rates of internet access or internet adoption. But then also seeing some SAFE members really exploring electronic surveys that have some, obviously you can get the results kind of analyzed and tallied quicker, and it allows you to do some skip logic where you can, make the residents can skip some questions that don't pertain to them and make the survey slightly shorter. The third question to think about would be how often to do the survey. I think when I first started at SAFE years ago, it seemed like most folks were doing annual surveys, and I think since then, in the last few years, we've seen somewhat of a trend towards perhaps more biannual surveys or other timing, just kind of recognizing that doing this and doing it well is a big, a lot of staff capacity and time for residents, and recognizing that some of the data you're collecting may not change very much year over year, may not be a ton of movement. So, is it better to do it every other year and really, make more of an effort and have more capacity that way to do it every other year? But depends on the organization. And then fourth item there, uniform or customized. You want to have one survey across the standard across all the properties that allow you to aggregate the results and compare across properties, or do you want to give regions or properties more ability to kind of customize their surveys, maybe add some questions on to the end, or perhaps even have residents engage in the survey design to help tailor questions that matter to them, which is a great way to kind of get resident input and engagement, but it also can be challenging from an analysis perspective if you're trying to look across. So Alexandra, advance. Some other things to think about, survey length. Of course, the longer it is, the harder it might be to get residents to do the full thing. I've heard from some organizations that they might say, the survey is 3 pages, no more than 3 pages, and whatever can fit in 3 pages it will be included, and then that's it. And that's kind of the guiding benchmark. That different folks take different perspectives on that. Some of the SAFE members are experimenting a little bit with sampling, trying to address this issue of, the reality of doing this is that you tend to get more responses from residents who have more time and bandwidth and perhaps more kind of trust with the property or staff to take the survey. So it's just naturally gonna lead to a bit of bias, or the results might just look slightly different than what they would look like if you had gotten every single resident to take the survey. So that's the sampling can be a little tricky, so we can come back to this concept if folks are interested in, and some of the other presenters might talk about it a little bit. Incentives is another thing that folks are thinking about for surveys. It could be, things like if you take the survey, you might get entered into a raffle. There might be like parties that have food, or other incentives kind of for taking the survey. We've also heard about incentives for property staff to try to encourage, like perhaps service coordination staff to reach a goal of survey responses. The property that gets the highest response rate gets some sort of prize. Next slide. So briefly on this, the SAFE members are thinking a lot about how to best make surveys as resident-centered and equitable as possible. Trying to really think about the burden of data collection on residents, the fact that residents may feel some pressure to answer surveys in a certain way or to give certain responses. So this is, kind of an ongoing practice, but some elements of this to consider might be thinking about how you might incorporate resident feedback and voice broadly into the cycle of data collection, which I'll talk more about in a second. Really emphasizing the surveys are voluntary, that they will have no impact on their housing status, and emphasizing that in multiple ways in text and in practice. Trying to minimize the amount of data you're collecting and link the survey or the frequency of doing it. Of course, thinking about data security and the databases in which you're storing information or Excel spreadsheets or whatnot, kind of trying to make them as secure as possible. Giving the data back to residents, the survey results, in the most effective ways possible. And then just lastly, thinking about resident consent for data sharing, and kind of different ways to get at that. Next slide. So when we're thinking about resident participation and agency in this process, kind of a lens of how we have thought about this is this idea of participatory action research, PAR, which is kind of a evolving, I think, thing in the evaluation space of being very collaborative and involving kind of survey research participants, it's the kind of the formal, but really just could be survey respondents in the whole process. So, this could be a range of things. Some of these are heavy lifts and some of them are lighter lifts, but it could be getting resident input on the design of the survey or the wording of the question to see if, some questions make sense and some don't, perhaps. It could be actually perhaps involving residents in the actual administration of the survey. I mean, obviously this depends on the survey questions, kind of how sensitive they are. But we have heard of some kind of trial runs of having residents kind of administer the surveys to each other and otherwise kind of participate in kind of the rollout of surveys. And then lastly, of course, sharing the data back with residents and kind of inviting their interpretation of the results and then inviting their kind of participation and kind of deciding what to do with the data and next steps and whatnot. Next slide. So this is more about sharing data back with residents, but in the interest of time, I think I've gone a little bit over it. I think I'll skip over this a little bit, and I think that's the end of my slide. So sounds like we might pause for any questions before we move on.
Yeah, thanks, Nicole. If folks have questions, we're going to have, as I mentioned in the beginning, we'll have some time at the end after both Katie and Letitia have also presented. But if you have some questions specifically about some of the information that Nicole shared, we did have one that came in through the Q&A, Nicole, a coordinator who has had some challenges getting property management to share demographics and statistics because of privacy concerns. And I know this is something that we've talked about with our members in other settings. I think in some cases there are some questions around sort of structure and, if you work for the same parent company or not. I mean, generally my understanding, and then you fill in or correct me when I'm wrong, is that especially if it's aggregated information where you've removed any sort of, PPI or, any information that can be identified at an individual level, there shouldn't be a concern. But what else would you add to that?
Yeah, I mean, I would ditto that it seems like among the SAFE members that we see quite a bit of sharing between property management and resident services, particularly when you take out some of those, names and perhaps unit numbers and whatnot. But I would, this particular question, I would suggest perhaps if that's a stumbling block, maybe asking to see if you could get aggregated data back for the property, perhaps, and whatever, perhaps it could be divided out by, identifiers or whatnot. That maybe property management wouldn't have as much reservations about just giving kind of high level stats back. That might be kind of a stepping stone to other data sharing. It is a tricky area. I mean, there are, issues with that.
The other thing I would add, just to come up, good suggestion from Katie in the chat, talking with property management about why it would be helpful for you to have that, how you're planning to use it. One thing that I would also add is seen situations where an owner has a third-party property management company, and that still continues to be an issue. That owner, that data that the third-party property management is using should be shared with the owner for the properties where they're the owner. So that is another way is to engage the owner in that conversation as well. Looks like, do we have any other questions or comments right now? Yeah.
Susan just shared that, you may need to know residents' income level to help with them getting benefits or services. So that's maybe another thing to talk to property management about as well.
Okay, well, if there are other questions, please put them in the chat or into the Q&A. But I think we'll keep moving and turn it over to Katie from the Community Builders, who's going to talk about their approach to surveys and using resident outcomes. So Katie, welcome.
Hello, good afternoon. As mentioned, I'm at the Community Builders, which is headquartered in Boston, but we are a regional housing developer. I'm a part of the Community Life Department, which is also resident services. So we do resident services at some properties that are owned and managed by TCB, as well as at some third-party sites. So overall, we are at 54 communities right now, and about a handful of those are third-party managed. So just a little bit of background. We can go to the first slide. So as some of you may have experienced, our survey journey has not been linear. It has had several evolutions and detours, and it's been a long, winding road. So, and we have a lot of lessons we've learned along the way. So if people have questions or want to hear more, I'm very happy to connect with people afterwards to talk more about what we have learned in our journey. But we call it the Community Life Questionnaire, the CLQ, was first started to be collected in, I think, 2016. It was at a few sites that had a choice neighborhood grant starting in 2014. But really kind of started in earnest 2016 at about 6 communities. And now this year it has been, or every year since then, it was rolled out to include more community life sites as we came on board with more CL sites. And so this year, every site that has a staffed CL person are collecting a CLQ. So that's about 50. In order to create the survey, as Nicole had mentioned, the director of research at the time looked at TCB's strategic goals, specific community life strategic goals that were set, as well as existing grants, what was required, potential areas of impact they could have on residents, like voter registration, and a broad swath of what could be things that would be of interest to future funders or future grants. But that means until about 2020, there were only a few questions that were asked standard across sites, but then most of the survey was kind of ad hoc and experience the survey creep that Nicole had talked about of, it was very different across sites, and very few things we were able to speak to fully across the organization. So in 2020, the majority of the survey was standard. I think it's now officially 20 questions, but many are multi-part questions. And then as needed for specific grants, certain sites will have an addendum that have for funders or grants more specific questions related to their needs of what they need to collect. So most sites get we call it the short CLQ, which I laughed as Nicole said, 3 pages max. Ours printed is 11 pages. And then some sites have many more addendums, so it might take much longer to complete their surveys given the specific grants that we have. But in pulling the language for questions, where possible, they try to use existing standardized and validated questions from sources like the census or the risk behavior factor surveillance system. There are, I'm sure, many other places they tried to pull from, but they tried to use existing questions to not only make sure we had a reliable measure that we're using, but as well as to be able to potentially connect it to results from elsewhere. So like the information would line up for larger external data sources. At the end of last year, I conducted interviews with a few residents to get their perspective on the questions asked, because we've realized, we ask residents for a lot of data and trying to, we've heard from some staff that residents are hesitant to answer certain questions. But I ran into the challenge of the people who were open enough to talk to me and express their feelings didn't feel hesitant about answering the questions. So in lieu of that, we're planning to do more diving into it, but we're also looking at kind of skip rates for specific questions. We know health questions, certain health questions, a lot of people don't answer it because questions are voluntary to answer. So that also gives us an indicator of people don't want to answer this if it's blank a lot of the time. For survey administration, this again is the first year we've pushed for solely electronic collection using SurveyMonkey. Previously, it was allowed, so it is always an administered survey. So the staff person is reading it to the person who is taking, the resident who's taking the questionnaire. We did have the option previously for the staff to fill it in on paper and then enter it later, but that creates double data entry. And so this year we were really pushing to have the surveys entered, responses entered directly into SurveyMonkey. We're also testing out this year the ability, sending out an email link to residents for them to fill it in. So we'll see how many people actually take up that option. And we might be using that more in the future if we have a good success rate. We're still waiting to see on that. Historically, as Nicole had mentioned, some have a rolling collection. So sometimes people would do it in line with the research. They would have them do it at the same time. But it would be anything collected from July to June, and it would be counting as that year. We've now shortened the collection window just to, try to condense the time it's done, because it, can creep and just take up way more time than you want it to. So our window of collection is now January 1st to June 30th, but the bulk of surveys are done in March to June. The challenges we've made, or the changes we've made, have all been kind of in response to challenges that we're experiencing either with staff buy-in or the information that we're getting from residents. So such as entering them electronically, just doing it once. However, some staff are still resistant and prefer to have paper to fill in instead of a laptop between them and the resident. We also heard some people were just dropping off a survey, which was never how it was intended, because the pages, printed pages, would have skip logic, and that would be confusing for people if you're just reading it. But in general, the staff understand it, how it's helpful for them in terms of knowing what supports to provide for residents, which I'll show some dashboards later. But then also, collecting the surveys from residents is quite time consuming. So previously, across the board, there was a target completion rate of 70% of residents would have a survey completed. And it takes about 15 minutes each. So, across, hundreds of residents at a property, even, dozens of residents, that takes up a lot of time. So to reduce the amount of time required on staff's behalf, as well as staff and resident survey fatigue, because this was happening, every year since 2016 at many sites. This year, another thing we've tried to pilot is selecting a random sample of 30 residents. So staff have received a target resident list that was generated by our data analyst. They reach out to those people, get their response. Then if someone completes the survey this year, they won't be asked to complete it again for 3 more years. So it will give people a break, like residents a break in having to answer the questions every year. And then also for staff, they're only focused on 30% of residents versus the 70%. So, and we did that generating the list using the statistical software package R to just randomly select 30% of residents. And then we shared their names and contact information on a target resident list that went out to each staff member. So each site had their own list to reach out to. You could go to the next slide. So we have multiple ways that we use the data. First, each site has community-specific goals that they set each year. We call part of their community success plan. And the items that they select are mostly from the previous year's CLQ. So they refer to that data to set a goal about what they want to achieve that year. So goals could be on a specific metric, like 90% of residents will have a primary care provider. So they would look and see, oh, only 75% of our residents do. We're going to aim for 90 this year. And then here's our plan, how we're going to try to reach that. Or the goals could be related to programming. So something such as seeing, you want to host a voter registration clinic because the site has a low rate of registered voters. So programming and specific metrics for outreach. This also then indicates staff and regional directors can think about potential partners. So if there's a high rate of residents who indicate having diabetes, staff could then reach out to the hospital and have them come do a diabetes management clinic. So next slide, I'll show you some of the dashboards that we've created to help. So this one, it's part of our target for services report. I've blocked out the identifying information, but based on individuals' responses to the CLQ, we then basically flag everybody who might potentially need support from the staff member. So you'll see kind of the indicators on the side of like unemployed. For early education, these are the children who are ages 0 to 5, who the parent indicated they were not enrolled in some kind of early education. So the staff member would be able to reach out, and many you can see, still impacts of COVID, prefer to keep children home with a relative, on wait lists, things like that. So staff would also be able to see what the reasons are, and either, if they are on a wait list or didn't know of programs, they could connect them to programs. But also if they prefer to keep their child home, staff could connect them to kind of like, homeschool groups or help connect them to enrichment activities. So the child is still getting that kind of, enrichment. And staff are able to export these, so have them in Excel and then be able to reach out to residents. Next slide. We also have, once the survey is completed, a resident dashboard that shows a summary of information, across the board. The key indicators, which is this slide, are related to our strategic goals. So we can see, progress over time as things are changing. Clearly during COVID, things, got a little weird, but they're also filterable by region, and other ones are by specific site, which I'll show you in a minute. So if you go to the next slide. So these are just summaries of the same information based on theme, and these can be filtered for specific community or property, as well as for a region, and these can be exported as PDFs to share with partners. We also have a resident-facing version of the survey that has simplified dashboards, so it's not so much going on, to be able to share with residents, and they can use it for their own purposes. I know a few communities have started doing community data walks where they put these images up and have get feedback from the community on the information that we're collecting. So just to wrap up, we do acknowledge that now we're only focusing on 30%, which does get tricky when we're also using it to try to target people who need services. So we're kind of wrestling with that right now. But staff are also expected to have a one-on-one check-in conversation with every household per year. So ideally, if a family did require services, it would come up during that conversation as well. So we're not completely leaving people in the dark. In order to get the functionality for these reports, we hired a data analyst who is focused on this. I would say it has taken a lot of capacity. This is doing sampling will be challenging if you're the only data person at your organization, or if you're not the data person, someone else is doing it. But we are collecting the survey in SurveyMonkey, and then these are done in Power BI because they have a API automatic connection that we're able to establish. So I saw there were a few questions. Yeah, so these are done in Power BI, which is through it's available as part of the Microsoft Office suite. So I will stop there.
Great, thank you, Katie. If folks have other questions for Katie, please throw them in either the Q&A or the chat. In the interest of time, I'm going to keep going and welcome Letitia. So Letitia,
Hi,
just tell me to advance as you're ready.
Okay, hi, thank you for having me. And so I am just going to talk about the different types of slides that what actually made the process easier for us. And one of those processes was actually pulling out the system of resident coordination. I actually got this template off of online with your partnership with, I don't know if I'm saying it correctly, but I think we saw this slide earlier on, correct? I'm pretty sure we saw this slide earlier on. And so I decided, because I was new with Decatur Housing Authority, this is where I would start off with getting familiar with the organization itself and how they run, at that time, how we run our resident services coordination. And once I knew where the roles were, I was able to get where the roles lie in, who are our community partners and where do we get our funding from and who are our best allies. Once I decided to organize that, it was easy for me to get the information that I needed for CORES. And it actually saved a lot of time because I knew who to go to for different material or data that I needed to complete the core application. With that being said, it easily flowed here. I was very thankful to the template that you guys provided because I was able to plug it in and everything made sense for me as a new employee of the resident services coordinator for the Decatur Housing Authority. So once I was able to do that, we went into the survey and design implementation process because I wanted to know what type of information needed to go on the surveys. Once I did that, I went back to talk with the community partners. I pulled their strategic plan, I pulled our strategic plan, and I wanted to know how can we meet the goals on the plan for that particular year. We pulled questions that was important for the city, the school system, and also resident services for Decatur Housing Authority. And the questions that we came up with revolved around health, revolved around our cityscapes, also about the school system and how many of our kids or our youth was actually participating or engaged in early childhood. We also want to know what time should we do our activities, or if our community partners wanted to implement different things for our residents or different activities for our residents, when would it be a good time for us to have those classes? How would they would like for us to reach out to them in the future? Because if the survey process in which I envisioned didn't work, it was important for me to know how should I get feedback with them, to them in the future. The way we did our surveys is we went through Google Docs or Google Forms, and Google Forms is totally free. We identified our questions. I reached out to our partners to see what type of questions did they want on the survey. I also reached out to other stakeholders who fund some of our activities and asked them what type of questions they would need. It was important to have them on in this process because most of our funding, or some of our funding for activities that made an impact, came from our community partners. Surveys was really hard really hard to get from our residents because they were afraid of retaliation. And being new in this particular role, I didn't know that was an issue. So with resident services, we had to make sure that confidentiality was something that the residents knew that we took pride in, that we was going to make sure that their information wasn't getting out to anyone that they felt like could hinder their residency. Once we put that actually on the survey, we sent the survey out electronically, and then we also gave our elderlies, because we do work with the elderly population, we let them come in to actually fill out a paper one. Some of our residents we do have residents that also need help filling it out on paper as well. So we gave those residents an opportunity to fill those out. We had to keep, only thing that was revealed to us was their emails. So we had a third party compile those emails so we can make sure that it was confidential, and sent the electronic ones out to the ones that did not fill them out on paper. We also made sure that we was engaging the residents and making sure that the surveys were being completed, because we gave out our surveys during time which we knew that we were doing an activity that we had the highest resident participation, such as our toy giveaway during Christmas. When we wanted to give out the food boxes, we wanted to make sure that we had the surveys out then, that we had our computers set up to the survey, and residents can come inside to fill out the surveys on the computers if needed to. Our outreach cycle just consists of making sure that we have questions that was passionate to our residents, and also that was beneficial to our stakeholders, to ensure that the funding was in line with what their strategic planning was for that year. One of the program impacts, I think that's the next slide. Oh, well, it's the category. Sorry, I have it out of order. Some of the categories consist of transportation, dates and times of the activities, the interests and types of activities that our residents would like to have. We have an after-school program called the STAR program. We want to know about its impact. The access of health insurance, because we do a partnership with our school nurses at our schools, and they have different incentives and resources that could be beneficial to us. We also wanted to know, what was our residents' perception of our community? Was it a positive perception? That also helps our city decide on different things that they want to tackle to build a sense of community. One of the positive impacts that came out of the surveys from last year was our funding for the pre-K program. Our survey indicated that 48 out of 72 of our parents were not in any type of Head Start, pre-K or daycare program. When we talk with our Decatur Education Foundation is one of our allies and partners who like to fund activities not only for our family, our kids, but also for our adult families. Once they saw the numbers and we shared it with the school system, they felt obligated to find funds and resources to figure out, and also to figure out where are the barriers that are keeping these families from taking advantage of the Head Start program. Most of them indicated that financially and transportation. Pre-K is not, pre-K is free, but there's other obligations that the city or we have to take in consideration. And one of those things were transportation. Transportation to get the kids from point A to point B. The aftercare, which we try to encourage our parents to be self-sufficient. In order for them to do that, they have to maintain a job. So after school care is really important. Through the surveys and the numbers and the data, our partners were able to determine that $30,000 was something that they was willing to give the Decatur Housing Authority to ensure that these families received the education that they needed to ensure that our students were properly prepared for primary years. So surveys are really important and impactful if you get the right data, if you're also taking into consideration what are the strategic plans of your stakeholders and your partners, and also sharing your story. And so CORE helped us be able to do that. Some of the data that you see here are just some of the information that we was able to obtain from the city of Decatur and also our resident services department. These are all the slides and the data calculations that Google Docs will curate for you. So once you go through each of the data slides, then you would see that none of the information actually articulate the findings. So that's something that you're going to have to do. So that's one of the caveats to Google Docs is that you're going to actually have to break these numbers down and actually write in or type in what were the findings. Your community partners, once you show the data, they're really helpful with actually articulating that if you have some brainstorming meetings on what they see. It's also important to share with the residents the findings. Sometimes that's something that we leave out. It's important to show this is what the survey results were, and this is the impact that your feedback was given. All of our parents are really excited about the opportunity for their children to be able to go to a Head Start program or a pre-K program in the city of Decatur. Now, all of this was done through this particular survey. If there are no results or anything that you can't do within the next 6 to 12 months, articulate that to the residents. Let them know what's your timeline. Let them know that you have a plan. Share with them your plan, and they will be excited to fill out the surveys because they know they're going to see some outcomes.
Thank you, Lakeisha. That was really helpful and some really great information, especially around the impact of your program and what you were able to achieve. So thanks for sharing that. We do want to have some time for questions. So if anyone has any specific questions they want answered, please feel free to put them in the Q&A function or the chat. And, you know, I can just sort of, if there are no questions, start us off with one question I had just broadly for all of you, which is, you know, what is your top or one piece of advice you would give someone on developing their survey? So what's something you feel that's really important and impactful to that process that you would want folks to consider? And I'm opening it up to the group.
You kind of just mentioned impact in asking the question, but only collect things that would be useful. Survey creep is very real, and like just wanting things for the sake of knowing, but make sure you have a plan for how you're going to use the information that you're collecting before you ask it.
I would say create a team to tell what is actually going to, create a team to decide what is going to be on the survey.
I would say think about if there are like comparable data that you can use to understand the data, the survey results that you get, like benchmarks and neighborhood level benchmarks, that when you get back the data and it says something like 70% of residents have health insurance, right? Is that good? Is that bad? Particularly if you're just starting out on this. And also like limit the number of open-ended questions as much as possible, because you get the data back and then you're like, oh gosh, I don't know what to do with all of this. I've seen a lot of struggle with open-ended questions.
Yeah, if you ask open-ended questions, that means you then have to read open-ended questions. So use them sparingly.
Good point. Any other questions folks have? I know someone asked about if we'll be able to share slides. I think if that's okay with the presenters, we'll be able to share slides with you all as well. One other question I wanted to ask you all. So we sort of touched on this a little bit, but what strategies do you use to get staff buy-in and support when you're collecting data?
Well, when I'm trying to get my peers help and buy-in, I just simply ask them what type of questions they want to be on there. Because if they feel like it's questions that help them, property management, they feel like, well, you know what, this is a question that I always wanted to know. And this helps me out because I'm able to get what I need. Then they feel like, okay, I need this data just as much as you need this data. And so they're willing to help when they do their recertifications or different things like that to help me out. And because they see the residents more than I do at some time.
We have a question from Roxana. So how do you provide incentives if you keep the survey anonymous? I think that's probably a question for you, Lartisha. I think you mentioned some opportunities like that, but if others have thoughts too.
What I had to do, I was talking, because I was new, it was my obligation to get to know all of the residents. And so I just asked them, what are some of your concerns? So the incentive was just them feeling like their question was going to appear somewhere, or their concerns somewhere on that survey. And so that was the incentive itself. We do a lot of incentives for different things. So just letting them know, okay, it's going to be different the way I'm word this, but I am actually going to put this in there in the survey somewhere. And I just reassure them that their concerns are going to be addressed.
I think we have a few questions coming in. I know we're short on time, but maybe real quick. Katie, can you talk a bit about the process of administering the electronic survey? When you say staff read the questions, then enter it, do they enter it into SurveyMonkey after that?
Yeah, so staff will have either on a laptop or an iPad, they'll have SurveyMonkey pulled up, and then they read the questions and enter it right there. And they could be on the phone with a resident, or they are sitting with a resident in person and entering it.
We are out of time, so I just want to thank everyone so much for coming today, and thank you so much to our presenters. Just wanted to share here some helpful resources for you all as you think about your surveys and data collection. Please go ahead and visit the CORES resource library, which has some wonderful resources and survey examples. from some of our CORES certified organizations. You can also sign up for our quarterly newsletter and find our webinars either on our YouTube channel as well as in the CORES resource library. And always feel free to find us on LinkedIn and Twitter for our latest updates. Thank you everyone so much. And if you have questions, definitely I think feel free to reach out to the presenters if you want to share your information in the chat for folks who have maybe some follow-up questions. That would be great.
Nina, I was just going to add, I see that a couple questions just came in. For those that we didn't get to, we'll try to circulate that amongst the presenters today. And in our follow-up email, we'll try to get some responses to anything that we didn't get to. So again, on behalf of our presenters and on behalf of CORES, thank you all and have a great afternoon.